Why GNC and why GNC8? I think the other things which I have told you, the other organizations, they are involving here. The most authorized organization is GNC 7 or 8. These two conferences given us much knowledge about this subject. They also describe how to evaluate the patient, and they also used the terminology that the person is pre-hypertensive, the pre-diabetic, for example. In the same fashion, they're pre-hypertensive. And the other aim of our discussion is to achieve the goal, to get the goal. The goal is to get the goal. This is the slogan of the presentation. Why we need the GNC 7 or GNC 8? It is 7 actually, which I am following 7 or 8 modification in 7, because it is clear, concise guideline with a greater clinical utility and significant number of the patients still without adequate BP control. Still, there are persons which are not significantly controlled. As far as your country is concerned, 18%, 20% are the cases who are diagnosed as hypertensive. They are screened for the hypertensive. These are the persons who usually came in primary, secondary or tertiary settings. Otherwise, no camping has been done properly in this country to see how much cases are normotensive and how many cases are hypertensive. We don't know. But the 18%, this is a study done about 5 years back. And in 18%, 60 to 70%, they took treatment. 30 to 35%, they do not want to be treated by you. They want to treat it by themselves or by other means, alternative medicines. Those persons who are under treatment of the physicians, even then, 50% are the people who are nearly controlled blood pressures. And in which case, the 12.5% are the people who have hypertension with every therapy. They have tried every therapy on them, and still they are hypertensive, and they are called as refractory hypertensives. So resistant hypertension in your country is about 12.5%. So GNC classify or GNC 8 classify, very simple classification, but it's depending upon this observation that above 115 to 75 CVD, the risk doubles with each blood pressure increase of 20/10. This observation is very important, which is written here. It doubled. The pre-hypertension is the terminology which is used to just remind the patient that the blood pressure is normal. It is not much blood pressure, although it is. But it is systolic blood pressure, which is 120 to 139, and the diastolic blood pressure between 80 to 89. They prone to develop hypertension in very near life. तो वो डराने के लिए इस्तेमाल कर रहे हैं टर्मिनोलॉजी. इसको हाई नॉर्मल कहते थे एक ज़माने में. दिस इज द सेम टर्मिनोलॉजी वी यूजिंग एज अ प्री हाइपरटेंशन. किसी को पता चल जाएगा 135 है वो पहले तो होशियार हो जाएगा. Drugs are not needed in most of the cases. Only lifestyle modifications are advised. The person को पता चल जाएगा तो उसको जो है खतरा है. Now in this GNC7 and GNC8, the important point is that those drugs which are not used often by the physicians and hypertensive specialists or cardiologists, they are called neglected drugs. They are the good drugs as the initial therapy, and they are diuretics. And in diuretics, the thiazide type of diuretics are one of the best initiating therapy in most of the cases. And if the blood pressure is higher than that, which is called stage 2 hypertension, you need 2 drugs to give, not 1 drug. And third point is that if the blood pressure is above the goal of 20 by 10 millimeter, then initiate therapy with the 2 agents. As I said, the slogan is the goal is to achieve the goal. Goal is to achieve the goal. This is the slogan. The patient should be evaluated. The blood pressure should be checked properly. You should know how to check the blood pressure. 2 consecutive blood pressure measurements are needed. It may be 5 minutes apart. It may be 1 hour apart. It may be 2 hours apart. It is a debatable question. But 2 consecutive blood pressure measurements should be there, according to the American Heart Association and GNC8. Although the British want at least 5 readings, abnormal 5 readings, and the Canadian want, they demand more than 11 abnormal readings in 1 month. Then they diagnose this condition as hypertension. The simple is that the first reading was taken by the patient himself at the home. For example, it is 180 by 110, and second reading is taken by you at your office, is 150 by 100. Now both readings are abnormal readings. And this patient should be considered as hypertensive. According to the GNC 7 or according to GNC 8, not by the British, not by the Canadian Heart Association. In the office you can take it should be taken on the chair. Self-monitoring, self-measurement can be done, and if there are chances that the blood pressure was normal previously 10 minutes before when he arrived in your office, now it is raised to 40 millimeter systolic now, jumped out, accentuated. The patient may have got what is called white coat hypertension. Because of the fear and because of the abnormal environment or a strange environment in the office, probably the blood pressure increases. Now, to decide whether the patient is still hypertensive or not, the best way to do is what is called ambulatory blood pressure monitoring. Now, this is done in certain centers in Karachi. You ambulate, you work in 24 hours, 48 hours, 72 hours or 1 week. They collect the data by the computers which is centrally placed, and the average systolic blood pressure and the average diastolic blood pressure will be determined, and the case can be labeled easily. The patient is hypertensive or it is not hypertensive. Patient is not hypertensive. So self-measurement of the blood pressure has got many advantages but disadvantages also. The patient may become what is called hypochondriac, taking blood pressure day and night, morning and evening, हर 2 घंटे बाद ब्लड प्रेशर चेक कर रहा है वो. उनका एक ही काम रह गया है कि ब्लड प्रेशर चेक करो. I have seen 3 cases or 4 cases of the persons who become hypochondriac and they are taking blood pressure since 15 years. They are going to different clinics. They are taking blood cell. They are measuring blood pressure themselves and always saying that कि आप झूठ बोल रहे हैं, मेरा घर पे ब्लड प्रेशर 150 था, मैं यहाँ पे आया हूँ तो नॉर्मल हो गया हूँ. And this is how the disadvantage occur. It is battery operated instrument. The best instrument you use is aneroid type of BP apparatus, sphygmomanometer, or mercury type of the blood pressure measurement, or a sphygmomanometer is a good one, but it is difficult to manage because the mercury column, there is a bubbling, air bubbling do occur and give the false impression. So the blood pressure classification is the normal is always less than 120 and diastolic blood pressure is less than 80 is always from 1965 to up here. They decide that less than 120 is normal, less than 80 is normal. But remember, more is the systolic blood pressure, more are the chances of the increased morbidity and mortality of the heart disease. That person who has got 125 millimeter systolic blood pressure and that the person who has got less than 120 millimeter blood pressure are not equal as far as morbidity and mortality is concerned in the future. They have the blood pressure, systolic blood pressure is more than 120 to 139 and the diastolic blood pressure is 80 to 89. This is known as pre-hypertension. It is actually normal one. It is high normal. But it is definitely cause the sustained hypertension in very few months or years. The patient become cautious. Patient become cautious for the future events. Stage 1 hypertension is more than 140 to 159 systolic and diastolic is between 90 to 99. Stage 2 hypertension is the hypertension in which the systolic blood pressure is more than 160 and the diastolic blood pressure is 100. Both of these conditions need treatment. Now this is the comparison which is given. Because a lot of organizations are involved. Now this chart signifies that and relaxes, gives some support to the person who is more than 60 years of age. In GNC8 they said that they are not hypertensive till their blood pressure is more than 150 by and more than 90. They should not be labeled. After the age of 60 up till to the age of 80 or 90, whatever it is. And they give relaxation to the diabetic patients also, that they can maintain their blood pressure to less than 140. And in case of the chronic kidney disease also, they have got relaxation. They should be labeled hypertensive after they will cross systolic blood pressure of 140 and diastolic blood pressure of more than 90. So relaxation has been given in these two conditions. Why? Because in diabetes the retinopathy worsens if you reduce the blood pressure less than 130, less than 120. I have seen the cases of the diabetic patients whose physician want to maintain the blood pressure less than 100. This is wrong. It will enhance the hypertensive retinopathy in the diabetics. In the same patient, the kidney needs a good GFR. And a good GFR depends upon the blood supply of the heart, of the kidneys. The kidney, the blood pressure should be at least 130 to 140 systolic. If it is more than 140 by 90, then you should label it. Otherwise, the renal GFR will become decreased. Now, this is a very, very interesting slide in front of you. A very recent study done by the American College of Cardiology and Heart Association and Stroke Association. Although it is agreed by the other nations, China, Japan, and other nations, and in Europe, they have not agreed on it. But anyway, they say the normal blood pressure should be less than 120, and diastolic blood pressure is less than 80. If it is more than 120 to 129, it is called elevated blood pressure. The drug is not needed, although only preventive measures should be taken, and the diastolic blood pressure should be less than 80. The third point is important. If the systolic blood pressure is more than 130 to 139, it is called stage 1 hypertension. In the previous slide, you say that it is more than 140 when you label the stage 1 hypertension. Now they said that no, 10 millimeter reduction उन्होंने कर दिया इसको. I already said if the systolic blood pressure increases, there is more chances of heart disease in the future. There is more chances of increased morbidity and mortality of the heart diseases. That is why they have reduced 10 millimeter. Although it is not accepted by many authorities. If it is more than 140 or higher systolic blood pressure, it is called stage 2 hypertension. In the previous slides, it is stage 1. Now here in this slide, it is 140 or higher, it's called stage 2 hypertension. And another terminology they have introduced, if the blood pressure is more than 180 millimeter and diastolic blood pressure is more than 120, then the terminology they are using called the crisis of the blood pressure, hypertensive crisis. Hypertensive crisis, it may be hypertensive emergency or hypertensive urgency. Why pre-hypertension? I already said it is a condition जिसमें आदमी लटका हुआ होता है, ना इधर कर रहा है ना उधर कर रहा है, मेडिसिन खानी है नहीं खानी है, टाइप ऑफ द डाइट बोले वगैरह वगैरह, ये सारे मसाइल हैं विद द प्री हाइपरटेंशन. The only advantage that the patient awareness हो जाती है. This is the awareness of the patient that he is pre-hypertensive, although he is not hypertensive. But there are chances of hypertension in the future. The causal factors of the hypertension are manifold. I don't want to discuss. This is not the subject. The basic problem is atherosclerosis. As the age grows, the atherosclerosis goes. All those features which accentuate the atherosclerosis will cause the blood pressure to become higher and higher. All those cases where there is a spasm of the vessels or the caliber of the blood vessel is reduced will cause the blood pressure to rise. All. They promote therefore lifestyle modifications. How it will affect your blood pressure? The weight reduction in 3 months, if you reduce your weight 10%, 10 kilogram weight loss, it will reduce 5 to 20 millimeter of the blood pressure. 20 millimeter without drug therapy. DASH eating plan will reduce 8 to 14 millimeter of blood pressure. Dietary sodium reduction 2 to 8 millimeter reduction. Physical activity 4 to 9. And moderation of alcohol consumption or quitting of the smoking will reduce 2 to 4 millimeter. If you will add on the all of it, it is about 40 millimeter can be reduced with the lifestyle modification without drug therapy. ऐसे मरीज जिनको जो है ना ड्यूअल थेरेपी दे रहे होते हैं आप, कॉम्बिनेशन थेरेपी, और जिनका बीपी एक ज़माने में 180/110 था, अब वो सख्त लाइफस्टाइल मॉडिफिकेशन पर आ जाते हैं, तो वो हाइपोटेंसिव हो जाते हैं, गिर जाते हैं. मस्जिद में अक्सर लोग गिर जाते हैं, इसलिए कि वो जब बीपी आप चेक करेंगे तो 100 से भी कम आ जाता है. इसकी रीज़न ये होती है कि वो स्ट्रिक्ट रखे होते हैं लाइफस्टाइल मॉडिफिकेशन पे. भाई अब इस मेडिकेशन या तो आप हाफ कर देते हैं या निकाल देते हैं उसको. बार बार जो होता है फॉल डाउन होते हैं, वो अपना काम नहीं कर सकते. हाउस वाइफ जो है वो अपना वर्क नहीं कर सकती, हाइपोटेंशन में कैसे वर्क करेगी बताइए. इसलिए लाइफस्टाइल मॉडिफिकेशन इज द बेस्ट वे टू डू इट. परमानेंट क्योर अगर है, कहते हैं ना हाइपरटेंशन का वो क्योर ही नहीं है, हाइपरटेंशन का क्योर है, बिल्कुल है. इफ यू विल अप्लाई लाइफस्टाइल मॉडिफिकेशन इन योर लाइफ, यू कैन क्विट द ड्रग थेरेपी. If you apply very strict lifestyle modification in your life, you can quit or you can reduce the anti-diabetic drugs even. ये प्लानिंग ये सामने जो आपके लिखी है, दिस इज वेरी इंपॉर्टेंट प्लानिंग. Now the impact of the 5 millimeter reduction of the blood pressure systolic will reduce 14% of the stroke, 9% of the coronary artery disease, and 7% all cause mortality. Very important impact. Only 5 millimeter reduction. 10 millimeter reduction पे भी जाएंगे तो और इसका डबल करते हैं आप तकरीबन. So there are a lot of options actually. मैंने कहा ना आपसे पहले, the thing is this, कि time is short. I want to discuss many things regarding the lifestyle modifications. One planning is a diet planning, it is called DASH diet planning. Another planning is my planning, which is given to the patients. It is called AHN type of the diet. There are 39 patients registered with me with this eating plan, and they have reduced their weight, they have reduced their doses of the blood pressure, they have reduced their doses of the diabetes with the planning, modified DASH eating plan. So it is a big subject. I don't want to discuss what you should take in the morning and evening and etc. because it is another subject. One should go for another lecture on the lifestyle modifications. Now the classification I have already done. I previously said GNC 4BT, 6BT, now 7, now it is 8, and coming year में जो है वो 9 करेंगे वो जॉइंट नेशनल कॉन्फ्रेंस इन न्यूयॉर्क में होती है ये, और इसमें जो है तमाम ममालिक शिरकत करते हैं. अभी जो अमेरिकन कॉलेज ऑफ कार्डियोलॉजी ने जो कहा है कि 130 के ऊपर लेवल कर दें आप, स्टेज 1 हाइपरटेंशन, इसके ऊपर डिस्कशन होगा कमिंग ईयर में. द गोल इज टू गेट द गोल. ये बार बार याद रखिएगा. हाइपरटेंशन अगर आप किसी को लेवल कर रहे हैं तो आपको 130 से ज़्यादा ब्लड प्रेशर चाहिए, तब आप कहेंगे कि ये ब्लड प्रेशर ज़्यादा है. और अगर डायबिटिक है, रीनल डिजीज है, उसमें आप छूट दे दीजिए 10 मिलीमीटर. So lifestyle modification plus pharmacological therapy are needed in these persons. अब इस किस्म के एल्गोरिथम को पढ़ाना या बताना जो आपके सामने आया है स्लाइड, you read it. These are the same things which I have told you just now. अब मसला ये था कि what to choose first. मुझे बहुत पहले से झगड़ा चला आ रहा है कि भाई किसी को बीपी हो जाए तो क्या करना चाहिए. प्रिवेंशन आपने बता दिया, ठीक है. ड्रग कौन सी देंगे, ये बहुत ज़बरदस्त आर्ग्यूएबल क्वेश्चन है. जो मेडिकल रैप्स आते हैं और आके बताते हैं कि ये ड्रग्स हैं, ये वाली ड्रग्स इस्तेमाल करें आप, जनरल प्रैक्टिशनर उसको फॉलो करते हैं हमेशा. वो ड्रग्स लेके आके दे के चला गया, बहुत सारे सैंपल दे के चला गया, उन्होंने वो दवा देनी शुरू कर दी. इस तरह से जो है ना कभी भी चूज नहीं करते एंटी हाइपरटेंसिव को. सबसे पहले एंटी हाइपरटेंसिव जो है ड्रग जो है उसको आपको जो चूज़ करना है वो अकॉर्डिंगली चूज़ करना है, अकॉर्डिंग टू द पेशेंट. किस टाइप का मरीज़ है, कितना ब्लड प्रेशर है, क्लासिफिकेशन का क्या है उसकी, कितने रिस्क फैक्टर्स हैं उसमें, कितनी कोमॉर्बिड्स हैं उसमें. ये सारी चीज़ें जो है ना मालूमात होंगी तो पता चलेगा कि व्हाट ड्रग इज शुड बी यूज्ड. अदरवाइज एट रैंडम जो है ना जो जहन में आ गई दवा वो कभी भी ना लिखिए. द ओनली मैसेज विच आई विल गिव इज दिस. अगर आपको कुछ समझ में नहीं आता तो स्टार्ट विद द डायरेटिक्स. ये आपकी चॉइस है, आप कौन सा डायरेटिक देते हैं. द अमेरिकन हार्ट एसोसिएशन एंड WHO recommend that type of diuretic should be given first. At one time they say the ACE inhibitors should be started. Still other authorities say that calcium channel blockers are safe drugs. The thing is this कि यह पेशेंट टू पेशेंट वेरी करती है. क्या ये मरीज जो है ये थायराइड डायबिटीज को बर्दाश्त कर सकता है, सवाल ये बताता है. फॉर एग्जाम्पल ही वो पर्सन है जिसको बहुत ही इम्पोर्टेंट सुबह का काम करना है. अब उसने थायराइड डायबिटीज आपने दे दी उसको, उसका वर्क ख़राब हो जाएगा सुबह के 2-3 घंटे. इसलिए है कि उसको हर 15 मिनट के बाद जो है ना वो वॉशरूम जाना होगा. अब अगर 15 मिनट के बाद वॉशरूम जाता है तो वो जो वर्क कर रहा है वो डिस्टर्ब हो जाएगा। ऐसे आदमी को थायराइड डायरेटिक नहीं दी जाती। ऐसे आदमी को थायराइड डायरेटिक दी जाती है जिस आदमी के पास 3 to 4 आवर्स हों सुबह के औकात में, ख़ास तौर पे जब वो ये बर्दाश्त कर सके वॉशरूम जाना। शुरू में जो है इन द इनिशियल पीरियड द थायराइड डायरेटिक्स they are more urination, and after 1 week the patient settle down to 1 to 2 in 3 to 4 hours. इसलिए जो ड्रग टॉलरेंस डेवलप हो जाएगा। Anyway, they are very good drug, but they are neglected drugs. एक और दूसरी बात याद रखिए कि हमेशा याद रखिए कॉम्बिनेशन दें लो डोज में दें, हमेशा हीरो के टाइम मत करें। केवल सर्टा 160 मिलीग्राम दे दी मैक्सिमम डोज, मेटाप्रोलॉल जो है वो मैक्सिमम दे दी 400 मिलीग्राम, मारा जाएगा आदमी मेरी तरह से। ऐसे थेरेपी नहीं देनी चाहिए जिससे हाइपरटेंशन हो जाए, या खुदा न खास्ता जो है अगर हाइपरटेंशन हो और सेरेब्रोवास्कुलर एक्सीडेंट होने का चांस बढ़ जाएगा, रीनल इस्कीमिया का चांस बढ़ जाएगा। इसके अलावा जो है ना, अगर डायबिटिक पेशेंट था तो रेटिनल इस्कीमिया के चांसेस बढ़ जाएगा। रेटिनल जो रेटिनोपैथी है विल बिकम मोर डेंजरस सिचुएशन। तो लो डोज कॉम्बिनेशंस कैन बी गिवन। वो अब आपकी मर्जी है कि आप कौन सी दवा देना चाहते हैं। A for ACE inhibitors and A for the angiotensin receptor blockers, B for beta blockers, C for calcium channel blockers, D for diuretics, E for other drugs. अब आप कॉम्बिनेशन जैसा भी चाहें दे दें, बट लो डोज कॉम्बिनेशन शुड बी यूज एंड इफेक्टिव होता है। Utilization of the low dose combination therapy can effectively reduce blood pressure while limiting the incidence of the side effects. The risk stratification is de-emphasized in GNC7. तो रिस्क स्ट्रेटिफिकेशन जो है GNC8 ने अलबत्ता जो है उसको कहा है कि आप वो निकालें, वो कैलकुलेट करें यहाँ कि इस पेशेंट का कितना रिस्क स्ट्रेटिफिकेशन है इन द फ्यूचर, बिकॉज ही इज कंपेयरिंग फॉर द ही इज गोइंग फॉर द कॉम्प्लिकेशंस एंड देयर आर सर्टेन कंडीशन इन विच देयर आर सर्टेन स्पेसिफिक antihypertensive are more effective than others. For example, in the heart failure, the thiazide diuretics, beta blockers, ACE inhibitors or receptor blockers, they are effective drugs. In the post-myocardial infarction zone, the beta blockers and angiotensin enzyme inhibitors are good drugs. In high coronary arteries risk, thiazide, beta blockers, ACE inhibitors and calcium channel blockers. In diabetes, in ACE inhibitors, receptor blockers, calcium channel blockers, thiazides and beta blockers are good choices. In chronic kidney disease, the ACE inhibitors, if the creatinine is less than 1.7, or ARB can be used. Otherwise, you will give the beta blockers or calcium channel blockers. Recurrent stroke prevention, the best drugs used are thiazides and the ACE inhibitors, but the new research has said that the calcium channel blockers are more beneficial. These are the compelling indications. The goal is to achieve the goal. This is the slogan. So, hypertension should be labeled if it is more than 130, not less than 130. ओनली डायबिटीज 10 मिलीमीटर, मैंने कहा आपको, इसमें आप वो दे सकते हैं, एडवांटेज दे सकते हैं इनको कि वो ज़्यादा, थोड़ा ज़्यादा रखें। अगर वो गोल अचीव नहीं कर सकता, दैट गोल जो आपने रखा है, इसका जो है ब्लड प्रेशर कम से कम 130 से कम होना चाहिए, तब जो है आप सेकंड ड्रग डालेंगे। अदरवाइज जो है ना, वो उसी डोज को जो आपने रखी है उस डोज को बढ़ाए, उस वक्त तक बढ़ाएं जब तक कि कोई ऐसा साइड इफेक्ट डेवलप ना हो जाए। फॉर एग्जाम्पल, आई स्टार्टेड द मेटाप्रोडोल 25 milligram. I do not achieve the goal, I will increase to 50 milligram, then 75, then 100 milligram. अब 100 मिलीग्राम के ऊपर प्रॉब्लम ये आ गई कि उसको जो है ना ब्रेडिकार्डिया हो गया। अब इससे ऊपर मैं दे नहीं सकता ये, और द गोल इज नॉट अचीव्ड, द ब्लड प्रेशर वॉज नॉट टच टू नॉर्मल, दैट टू मी इट इज 130 फॉर एग्जाम्पल। Then I will introduce another drug in a very low dose. That's a metoprolol 100 milligram south, 12.5 milligram hydrochlorothiazide I will add. Probably this will work. There are identifiable causes of hypertension. जब आप निकाल देंगे तो बीपी कंट्रोल करना आसान हो जाएगा, जैसे obstructive sleep apnea, drug-induced or related causes, chronic kidney disease, primary aldosteronism, renovascular disease, chronic steroid therapy, pheochromocytoma, coarctation aorta, thyroid or parathyroid. These are the secondary causes of hypertension. And there are causes of resistant hypertension. Improper BP measurement. उन्होंने जो आला लिया था वही ख़राब था। अक्सर होता है कि द पेशेंट ब्रिंग देयर ओन अपरेटस, और हम अपने से कंपेयर जब करते हैं तो पता चलता है कि उसमें 20 मिलीमीटर का डिफरेंस। एक्सेस सोडियम इनटेक, किसी को पता ही नहीं है कि जो सोडियम वो ले रहा है वो कितनी ले रहा है। इन योर कंट्री salt without life is no life. मरीज के लिए नमक कम करना जुए शीर लाने के बराबर है, बहुत मुश्किल काम। इनएडिक्वेट डायरेटिक थेरेपी, मेडिकेशंस लेते हैं लोग, इसके साथ बहुत सारी लेते हैं, एंटीसाइकोटिक्स हैं, एनएसएइड्स हैं, कॉक्स-2 इनहिबिटर्स हैं, ओवर द काउंटर ड्रग्स हैं, हर्बल सप्लीमेंट्स हैं। वो ड्रग्स हैं जो पोटेंसी को बढ़ाती हैं, मेल पोटेंसी को बढ़ाती हैं, वो लेते हैं। ऑल्टरनेटिव मेडिसिन लेते हैं। अल्कोहल क्या इंटेक उनका होता है। एंड देयर आर सेकेंडरी कॉजेज ऑफ हाइपरटेंशन विच विल कॉज द रिफ्रैक्टरी हाइपरटेंशन और रेजिस्टेंट हाइपरटेंशन। So resistant hypertension is a condition in which the hypertension is not controlled by the 3 drug therapy at least, in which one should be a diuretic, and that is thyroid diuretic. अगर आपने ट्रिपल रेजिम दिया है, 3 ड्रग्स दिए हैं और फिर भी कंट्रोल नहीं होता, जिसमें से आपने एक थायराइड डायरेटिक भी इस्तेमाल की, तो ऐसे केसेस को रेजिस्टेंट हाइपरटेंशन कहते हैं। वो जो ड्रग्स हैं वो बहुत सारी हैं, आई डोंट वांट टू नेम ऑल ऑफ देम। फ्यू आर रिटेन वेरी इंपॉर्टेंट ड्रग्स आर एनएसएइड्स, usually use antidepressants and the metoclopramide antiemetic drugs. We use the anti-anxiety drugs, Buspirone. ये drugs, estrogens and steroids, these are used very commonly by the general practitioners. They are the identifiable causes of the hypertension, and the resistant hypertension. COX-2 inhibitor जो है inhibit the prostaglandin synthesis and that normally maintains the afferent arterial vasodilation. उनके साथ भी ये मसला है कि अगर ज़्यादा तादाद में दे दी जाए या प्रोलॉन्ग थेरेपी दी जाएगी तो इट विल कॉज मोर डिफिकल्ट टू कंट्रोल द हाइपरटेंशन. और ड्रग्स भी हैं, स्ट्रीट ड्रग्स हैं, हर्बल प्रोडक्ट्स हैं, कोकीन है, निकोटीन है, और ये दूसरी ड्रग जो स्ट्रीट ड्रग कहलाती हैं, एंजॉयमेंट्स की ड्रग कहलाती हैं, सेंट जॉन्स वॉर्ट एक्सेट्रा, दिस विल ऑल कॉज द blood pressure to become resistant and refractory. The substances associated with the hypertension, I always said, is sodium chloride, ethanol, and certainly the chemicals, thallium and lithium salts, and lead, they are associated with hypertension. Now, how will you manage this case? This is a rational combination therapy. It's called Chinese menu approach. Chinese menu क्या होता है कि एक चीज़ तो वो खाते ही नहीं है, वो सूप भी पीते हैं, उसके साथ उनके साथ जो होता है वो चिप्स भी होते हैं, और थोड़े से जो होते हैं वो नूडल्स भी खाते हैं, और चिकन भी खाते हैं, वो फिशेस भी खाते हैं, वो एक चीज़ नहीं खाते. वेजिटेबल्स होते हैं उनके साथ बहुत सारे, वो साथ खा रहे होते हैं. उस अप्रोच को कहते हैं चाइनीज मेन्यू अप्रोच. ना अलजेब्रा तो ब्लड प्रेशर क्या थी कि ब्लड प्रेशर इज द प्रोडक्ट ऑफ द कार्डियक आउटपुट एंड द सिस्टमिक वास्कुलर रेजिस्टेंस. एंड व्हाट इज कार्डियक आउटपुट? इट इज द heart rate multiplied by the stroke volume. If you put this cardiac output in this formula, the blood pressure is equal to heart rate multiplied by stroke volume multiplied by the systemic vascular resistance. So blood pressure is directly proportional to the increased heart rate, the increased stroke volume, and increased systemic vascular resistance. This is the basic principles of the management. You reduce the heart rate, you reduce the stroke volume, and you reduce to systemic vascular resistance, you can control easily the blood pressure. These three things, components of the blood pressure. More is the heart rate, more is the blood pressure. More is the systemic vascular resistance, more is the blood pressure. In the same way, the stroke volume, which is coming from the, according to the Starling law, from the venous side, pulmonary veins हैं या inferior vena cavas हैं, यहाँ से भी ये blood आ रहा है, in ventricles. तो stroke volume जितना ज़्यादा होगा उतना ज़्यादा blood pressure होगा. Thyroid diuretics now, talking about them. I said they are neglected drugs. There are many types of the diuretics we use. Thiazide, hydrochlorothiazide, chlorothiazide, chlorthalidone, and the potassium sparing type of diuretics, aldosterone receptor antagonists, and the loop diuretics, etc., etc. The second one is the nitrates. Remember, the aldosterone receptor antagonists are one of the best drugs used as a diuretic. Loop diuretics are used in emergencies, emergency condition in case of failure. Because a broad discussion is needed in aldosterone receptor antagonist is concerned. But this is a very important drug in cases of the resistant type of hypertension. कंट्रोल में नहीं आता ब्लड प्रेशर किसी का, तो एल्डोस्टेरोन ऐड कर दें इसमें. अगर एल्डोस्टेरोन ऐड कर देंगे आप, तो ब्लड प्रेशर विल बी कंट्रोल इन 3 to 4 hours. इट इज अ मैजिक ड्रग. आई विल से इट इज अ मैजिक ड्रग. नाइट्रेट्स विल एक्ट थ्रू द वेन्स एंड स्ट्रोक वॉल्यूम कम कर देंगे. नाइट्रेट्स आर ऑफ डिफरेंट वैराइटीज. इट मीन मोनोनाइट्रेट्स, डाइनाइट्रेट्स, ट्राइनाइट्रेट, टेट्रानाइट्रेट, एसेट्रा. ACE inhibitors and ARBs. Now these are the drugs जो सबसे ज़्यादा प्रमोट की गई हैं. इनकी लॉन्ग लिस्ट है. ये प्री लोड कम करती हैं, याद रखिए, यानी इसका मतलब है स्ट्रोक वॉल्यूम कम हो जाएगा. ये वीनस साइड पे एक्ट करती हैं. Beta blockers are acting directly on the heart, and there are a lot of beta blockers. There are two type of beta blockers. और इसके अंदर जो बीटा ब्लॉकर्स हैं वो बीटा ब्लॉकर्स हैं जिनके अंदर ISA बीटा ब्लॉकर्स कहलाते हैं. इंट्रिंसिक सिंपैथोमिमेटिक एक्टिविटी बीटा ब्लॉकर्स. एग्जाम्पल इज मेटाप्रोलॉल and bisoprolol. And now the nebivolol is a new drug which is invented and it is very good drug. The calcium channel blockers are again acting on the heart. It is also reducing the afterload. It is also reduced the afterload. So the drugs are manifold. Again, the most important drug which you use in this case is the amlodipine. Amlodipine is the drug of choice in most of the cases. Although the Diltiazem and the Verapamil can be used, and nifedipine are also good drugs in certain compelling indications. Now about the alpha-2 antagonists, centrally acting drugs. Now they act by the central mechanism. For example, clonidine. It is not any commonly used drug. And they have got the dihydropyridine calcium channel blockers. And I already said the amlodipine is one of the drug which is in combination is available. Vasodilators can be used in difficult cases like hydralazine and minoxidil. Alpha-1 blockers can be used. Alpha-1 blockers, they can be used also with the other drugs. Like for example, they are used actually in the hyper BPH. And they are the drug prazosin, for example, is the drug, or doxorubicin, the other drug. We combine this drug when there is a resistant type of hypertension or the patient is suffering from the BPH also. So the ACE inhibitors and ARBs with the other combinations as written in this slide, they are good combination if you are using. The pharmacological sides of action are written to reduce the stroke volume, thiazide, loop diuretics, aldosterone antagonists, nitrates, ACE inhibitors, ARBs are good. Directly acting on the heart rate को कम करना है तो बीटा ब्लॉकर, diltiazem, verapamil, nifedipine, while central mechanism clonidine can be used. While central mechanism you can use methyl dopa. The arteries are concerned means the peripheral resistance. The dihydropyridine like amlodipine, hydralazine, minoxidil, there are vasodilators, alpha-1 blockers. ACE inhibitors are also reducing the afterload. ARBs are also reducing the afterload. This is the Chinese menu approach. In those persons who are resistant or who are refractory to the therapy, they should be used a drug which will reduce the heart rate, the drug which will reduce the stroke volume, and the drugs which will reduce the afterload, means vasodilators. Choose one agent from each category. अगर हर एक में से एक एक ले लें आप, तीन को मिला दें तो बड़े आसानी के साथ जो है वो आप बीपी को कंट्रोल कर सकते हैं. In cases of those cases who are refractory to the therapy. Again, this is the same algorithm. मैंने कहा ना, एल्गोरिथम को पढ़ना आसान नहीं होता. आपके सामने है, आप इसको पढ़ें, समझें. पर जो इसमें एक जो है जो चीज़ जो है एंड में जो है जो आपको बताना चाहूँगा वो याद रखिए, स्टेज 1 हाइपरटेंशन में मोनोथेरेपी इस्तेमाल होती है, एक ड्रग थेरेपी। चूज आप खुद करें। इन स्टेज 2 हाइपरटेंशन dual therapy should be used, monotherapy should not be used because of the side effects. If you increase the dose of the one drug, the side effects appear. इसलिए क्या करते हैं कि dual therapy इस्तेमाल करते हैं in stage 2 hypertension. और इसके ऊपर अगर चले जाएं आप resistant hypertension या hypertensive crisis, तो आपको 3 drugs or 4 drugs, even 5 drugs can be used. And monitoring is needed in this patient. इनकी मॉनिटरिंग ये है कि वो खुद मॉनिटर करेगा, फॉलो अप करेगा, विजिट करेगा। आपको मंथली विजिट भी कराते हैं कुछ लोग, 3 मंथ्स भी कराते हैं, 6 मंथ्स भी कराते हैं। और इसके अंदर जो है जब भी बुलाते हैं तो टेस्ट करवाते हैं, हमेशा लिपिड प्रोफाइल को करवाते हैं और हमेशा यूरिया, क्रिएटिनिन, इलेक्ट्रोलाइट्स को करवाते हैं। So these are the discussion about the hypertension is concerned. How the blood pressure is controlled. So there are cases in front of you. ये सामने लिखे cases. There are many cases which I have seen. You will also see the cases in your life, and I hope so. These cases which are discussed here, case 1, read this case and diagnose this case and choose accordingly. Read the case 1 and choose the therapy accordingly. I don't want to discuss. In the same case 2, the all history is written in this slide. Read yourself, choose the drug yourself, and see the correct drug is chosen or not. So these are the cases which are written by me. Remember that these drugs, the drug you will choose should reduce the preload, that is stroke volume. It should reduce the heart rate, and it should reduce the peripheral vascular resistance. If you choose the 3 important target points, then all cases can be managed. The summary is the lifestyle modifications are important for the prevention. And the slogan is to achieve the goal. Goal should be achieved. Consider the compelling indications. किसी को डायबिटीज़ है तो अदर ड्रग है, किसी को क्रॉनिक किडनी डिजीज है उसकी अदर ड्रग है. In pregnancy, specific drugs are used only, which are allowed. So this is how we manage the cases. Now I have discussed about the classification. How will you classify the hypertension? How will you choose the therapy? And what are the recommendations which are given by the Joint National Conference 7 or 8? I thank you listen this lecture, although it is not complete lecture. There are 5 parts of this lecture. This is the only one part which I have discussed. Now 4 parts are left